Over the past, the uncommon viral illness known as monkeypox has frequently appeared on our news channels. The monkeypox virus, a species of the genus Orthopox virus, which is primarily found in the tropical rainforests of Central and West Africa, is the virus that causes human monkeypox, a viral zoonotic illness. People who reside in or close to forests may be exposed indirectly or at low levels, which could result in subclinical infection. However, imported African wild rodents carried the virus lately to the United States. This video is going to be about the rapid monkeypox outbreak. What is monkeypox? Though its symptoms are typically less severe, monkeypox is a viral illness that belongs to the same group as smallpox. It causes flu-like discomfort and a rash. Through close touch, it is infectious from human to human. Monkeypox symptoms include the following: an itchy rash that may first appear on your genitalia or pubic areas, pimple-like lumps, fluid bumps, or even open sores that resemble blisters, variations in the stages of bubbles, sometimes when they are developed nearby. Before the rash, some patients may not experience a temperature or flu-like signs. History and origin of monkeypox. The disease known as monkeypox was first identified many years ago after two epidemics of a disease that resembled the pox occurred in populations of monkeys that were kept for inspection. Despite having the term monkeypox, the cause of the disease is still unknown. However, rodents from Africa and non-human animals like monkeys may transmit the virus and infect humans. The first time that monkeypox was recognized as a unique disease was in 1958, with lab monkeys in Copenhagen, Denmark. The first known human pox case was 6 unvaccinated kids in the Democratic Republic of the Congo, who were 9 months old at the time of the first confirmed incident in 1970. The others, which included 3 mates, were in Sierra Leone and Liberia. It was noted that it spreads less quickly than smallpox. Over 300 human cases of monkeypox were documented in the DRC between 1981 and 1986, with animal interaction accounting for most scenarios. In 1996, the illness returned to the DRC, where human-to-human transmission was responsible for 88% of cases. Until 2003, when monkeypox broke out in the US, the illness was exclusive to the tropical rainforests of Western and Central Africa. All instances were linked to imported ill rats from Ghana. The disease was contracted by local prairie dogs, who then infected their owners. There were no fatalities and the illness was deemed to be mild. The disease was documented in 10 African nations between 1970 and 2019, predominantly in Central and West Africa. In 2018, 2 separate Nigerian travellers were found to have monkeypox in the UK. During that year, the very first human-to-human transmission outside of Africa were verified in the UK. This man was a healthcare professional who might have become sick using contaminated sheets. The CDC has so far identified nearly 2,900 diagnoses of monkeypox and a similar virus in the United States. In early June, there were 35 confirmed cases, thus this was an increase. Till today, the corporation had verified approximately 16,800 cases of monkeypox globally. Monkeypox. How deadly is it? However, the West African variant of monkeypox, which is spreading over the world, isn't particularly dangerous. According to some estimates, more than 99% of patients are expected to survive. Kids under the age of 8, those with weakened immune systems, and pregnant or nursing women are at particular risk of death if they become infected. Bruising from the rash is the most typical after effect of the illness. Monkeypox can cause significant symptoms such as breathing difficulties and bronchopneumonia, according to studies published in 2009. The virus can also cause eye problems and corneal scarring, leading to irreversible vision loss in extreme situations. The transmission of the virus. The virus that causes monkeypox is disseminated by direct contact with an infected animal or person. Animal-to-human transmission can occur when a contaminated animal's blood, body fluids, or pox lesions directly touch a person's skin. Monkeypox can transfer from one person to another, but this is rare. Encounter of the lesions, scabs, particles of respiratory fluid or oral fluid of an infected individual is the most common way of transmitting the disease from one person to another. It's still being investigated, but it's unclear if the virus is spread via bodily fluids or secretions. You can potentially contract monkeypox by encountering recently contaminated objects, such as clothes, blankets, and other materials used by an infected individual or animal. Prevention of the monkeypox virus. A smallpox vaccine is a protective barrier against monkeypox, although its use is confined to research trials. Reducing human contact with diseased animals and reducing person-to-person transmission is essential for prevention. Spreading of the monkeypox virus can be prevented by refusing to come into contact with people who may have been exposed to the virus. Avoid touching contaminated linens and other objects. Be sure to cook all meat and animal part-based items thoroughly. Masks that cover your nose and mouth should be worn whenever you're in a public space. Minimize contact with animals that could have been affected. Clean surfaces that are often touched. Treatment options available. People infected with monkeypox do not yet have access to effective cures, but some medications may help those who have the virus in the most extreme condition. Symptomatic treatment with over-the-counter drugs is sufficient in the majority of instances of monkeypox. Tecovirimat trusted source or TPOXX, an antiviral drug, can be used to manage more severe instances. Even though it is readily accessible, the medicine has not been specifically authorized to treat monkeypox. It was licensed in 2018 to cure smallpox in kids and adults, but no studies on monkeypox have been conducted. All diseases caused by orthopox viruses, including monkeypox, have demonstrated some efficiency on animal clinical studies. Obtaining this drug from the US stockpile can be challenging, according to several doctors who say they went through a long process to receive it for their patients. Dr. Roy Gulick, head of the Department of Infectious Diseases at Weill Medical College, said, "Currently, tecovirimat is only available from a CDC-sponsored expanded access program for patients at high risk for complications, those that are immunocompromised, pregnant, and children under 8, or with severe diseases such as lesions in the eye, mouth, and inner genital areas, disseminated lesions, or encephalitis." Brincidofovir Trusted Source, or CMX001, has also been licensed to cure smallpox. Doctors are presently developing a protocol for its use against monkeypox, even though it is more harmful to patients. Despite their potential, many doctors and pharmacies still do not have access to these drugs. As per Jeremy Walker, Associate Professor at Birmingham Division for Infectious Diseases, the primary treatment option is tecovirimat, which is not readily available in hospitals or pharmacies and must be obtained through a specialist working closely with the Health Department or CDC. WHO proclaims of the rise of monkeypox as a global medical emergency. Because of the rapidly spreading monkeypox outbreak, the WHO has raised its global health emergency alert to its highest possible alarm level. A collective international solution is required to stop the disease from spreading beyond and possibly rising into an epidemic, as indicated by the WHO's uncommon designation. Although this doesn't actually mandate anything, it functions as an important call to action. The WHO cannot impose mandates on any of its member nations. All it can do is provide advice and guidance. Each member state must notify the WHO of any incidents that could impact global health. Last month, the United Nations announced a global catastrophe due to the monkeypox outbreak. The WHO's Emergency Assembly met to evaluate the evidence and recommend the former director before a worldwide medical emergency is issued. In the end, there was no agreement on whether monkeypox was an emergency or not. Nevertheless, infections have risen dramatically in recent weeks. We have an outbreak that has spread around the world rapidly through new modes of transportation about which we understand too little. For all of these reasons, I have decided that the global monkeypox outbreak represents a public health emergency of international concern, Tedros stated. According to data compiled by the WHO, over 16,000 individuals have been reported to have monkeypox in more than 70 countries. Furthermore, the number of valid infections has increased by 77% from the end of June to the beginning of July. That's all there is for today. Leave us a comment of your thoughts on the rapid outbreak of this disease. Also, make sure to leave a like and subscribe to our channel if you enjoyed the video, and click the notification bell to never miss our videos. Stay tuned.